The Beverly Hills Guide to Liquid Nose Jobs. For patients seeking subtler aesthetic refinement of the nose, liquid rhinoplasty offers a quick and easy alternative to invasive surgery with no sedation and no downtime. A liquid nose job, injectable rhinoplasty, offers immediate, natural results in patients who either want a minor change in their nose or who are not psychologically or financially ready for a surgical rhinoplasty. A liquid rhinoplasty may be the correct choice for those patients who want to see what their nose looks like with a temporary and reversible cosmetic alteration before committing to the permanent results of surgical rhinoplasty. Plus, a liquid nose job requires little or no recovery time. Here's a quick guide. What is a liquid nose job or a liquid rhinoplasty? A liquid nose job or liquid rhinoplasty, or as it's called, an injectable rhinoplasty, is a new type of non-surgical rhinoplasty that uses injectable dermal fillers to reshape and recontour the nose. This procedure works very well in building up the nasal bridge, camouflaging a depression, or camouflaging a hump on the nose. In certain patients, botulinum toxin may be injected simultaneously to diminish the appearance of fine lines or wrinkles, so-called bunny lines, or to diminish the activity of the depressor muscles of the nasal tip, thereby creating nasal tip elevation. In my practice, we often do liquid rhinoplasty in conjunction with other facial fillers, such as chin augmentation. This maximizes the appearance of the facial profile and of other facial proportions. What are some liquid rhinoplasty considerations? Liquid nose jobs are indicated for patients who do not have an overly large nose, but have a small nasal hump or a tip that is slightly depressed or ptotic. The application of dermal fillers above or below the nasal hump can camouflage the hump and create a straight nasal profile. If filler material is injected into the nasal tip, it can lift the tip and provide increased nasal tip definition and narrowing. The combination of camouflaging the nasal hump and defining the nasal tip has a profound aesthetic impact on the nasal and facial profile. How long does a liquid nose job last? Liquid rhinoplasty is typically performed with hyaluronic acid fillers. These fillers are the safest because they can be reversed with an injection of hyaluronidase if a lump or a bump occurs after the injection or if there is impending vascular compromise. Interestingly, the duration of the results of the facial filler is related to the filler product itself and to the location into which it's placed. Hyaluronic acid injections into the nose last for a particularly long time. Although I quote a duration of 6 to 9 months, I have commonly seen fillers last 1.5 to 2 years in the nose without needing to be re-injected. I believe this occurs due to the relative immobility of nasal soft tissues. For these reasons, fillers in the lip last for a very short time and fillers in the nose can last for a long time. How much does a liquid rhinoplasty cost? The cost of a liquid rhinoplasty is based on the region of the country and on the experience of the provider. In most other areas of the face, patients are used to paying for the amount of filler used. I feel that liquid rhinoplasty is a specialized skill with greater risks, and it commands a higher price than other regions of the face. Inexperienced injectors may charge $600 to $700 for a liquid rhinoplasty, while more experienced injectors may charge $1,000 to $2,000. It is important to know that surgical rhinoplasty on a patient that has no prior surgery may cost $10,000 to $15,000, and for this reason, injectable rhinoplasty is much less expensive than is a surgical procedure. Revision rhinoplasty procedures often cost even more than this, and the differential is even greater. It's important to note that many injectors have very little experience with the nasal anatomy and the unique aesthetic considerations related to the nose. The increased complication rate with nasal fillers mandate that the patient choose an experienced person to perform injection rhinoplasty. Does it hurt to get a liquid nose job? Surprisingly, injectable rhinoplasties are relatively pain-free. The skin can be anesthetized with topical lidocaine cream, and most hyaluronic acid formulations such as Juvederm or Restylane, are mixed or premixed with lidocaine so that only the initial injection stings. The lower half of the nose has more nerves than does the upper half. So if these injections are performed slowly, and if a waiting period occurs after the first injection, all subsequent injections, except for the first, are not painful at all. While the nose is a very sensitive area filled with blood vessels and nerves, the vast majority of patients getting liquid nose jobs are pleasantly surprised at how relatively painless the procedure is. Depending on the method of your doctor, you will receive ice packs or topical anesthetics before your injections, and most dermal fillers include a dose of lidocaine to further dull the pain. The needle used for this is small and really thin. You may experience slight stinging and pressure as the filler is injected, but it's very tolerable, and an expert practitioner will check to make sure that you are adequately anesthetized and comfortable during the procedure. As far as pain afterward, there's virtually none. You may have a little tenderness, a little soreness when touching your nose or moving your nose, but this usually goes away quite quickly. Any swelling, redness, discomfort, or signs you have ever had the procedure done at all will be very minimal and will resolve quite quickly. How soon will my nose look normal after a liquid nose job? The advantage of a liquid rhinoplasty is that the results are present almost immediately. I often give patients right after their nose mirror, and they're astonished and immediately very, very happy. Because the swelling is fairly minimal, the results are immediate and representative of the final outcome. Your nose may show slight swelling, slight redness, slight bruising for a few days, but most patients experience no visible side effects, even the day of the procedure. Any signs you have ever had a liquid rhinoplasty done are usually only noticeable to the patients themselves and easily concealable to the outside world with makeup. Do you have questions? I work with patients like you every day. Call or email me to schedule a consultation. I look forward to seeing you in my office. Thanks for watching.